hepiniz hoş geldiniz. Doğru kullanırsam. Trichotillomania'dan çok bahsetmeyip daha çok ben tabii ki
I will be talking about cognitive behavioral therapy, CBT, and how to reverse trichotillomania. As İpek also mentioned, we see excessive hair plucking, but it's not only about hair, but also pubic hair, eyebrows, and eyelashes. So frontotemporal and perinatal area are parietal areas are impacted as in children, and it creates psychosocial problems, stigmatization and distortion in life quality, and etc. In adolescents and in young adults, the prevalence is 1 to 3.5%. We do not know prevalence amongst children. It starts in childhood or in adolescence. There are two ways of plucking, by the way. This is important in order to reverse trichotillomania. Automated one is much more observed in children. There is no awareness here. Because one of the targets here is to create awareness. Usually in calm activities, without awareness, without consciousness, and the child can just play with their hair, his or her hair, and then pluck it. But the one which is called focused, there is awareness, there is consciousness, and then it is like a response to some emotional or cognitive triggers, and this is much more observed in the adults. And sometimes there are also those cases where these two types can be seen. And before moving on to the treatment, of course, we have to have a good assessment, good diagnosis, a treatment plan, and it is very important to follow the differences in symptoms or severity of symptoms. Surveys, scales, photographs can be used in order to research the cognitive impairment associating circumstances. Pharmacotherapy and CBT, cognitive behavioral therapy, when combined, are much more successful. When we look at the techniques of cognitive behavioral therapy, there are many techniques, including habit reversal, like awareness training, relaxation techniques, dialectic behavioral therapy, and acceptance therapy is also important, which is also tried in this condition. It goes back to 40 years ago, as developed by Azim and friends, and HRT, habit reversal technique, is the one how we call, but skin plucking and nail eating and in other habits as well, we have the efficacy of this method. But in tic disorder and Tourette syndrome, ACT is also used. But then again, this also has been even more effective, as shown by the studies. HRT will work as follows. First of all, awareness, and then developing a counter response, and then social support. Of course, relaxation, cognitive strategies, and stimulant control can be added to this technique. Awareness education. It is to make the patient aware of this behavior that is plucking, because in children it's automated, it's automatic, so they're not aware of it. And then every aspect of this behavior should be made realized. And the severity, the duration, the time, where does it happen, and everything about this activity should be addressed. And the other is the triggering factors. These triggering factors should be looked into. For example, high-risk situations, when children go to their bedrooms, for example, when they start studying, for example, they are not aware, but they are plucking their hairs, for example. And each condition, each emotion, each behavior, and each emotional phenomena should also be researched. And also the impacts, repercussions, and what kind of outcomes does this condition bring along should also be discussed with the child. These are the triggering effects. These are the hints that trigger this impulse of plucking. We know that these could be external, like those furnitures or those places that remind plucking, like bedroom or like a mirror. And then internal hints, such as anxiety, distress, or some visual and tactile senses, and some cognitive hints, like assuming that her hair or his hair should be in symmetry. And then the other triggering mechanism is a different stimulant. It could be again external and internal, like those spaces where nobody resides, for example, bedroom or bathroom. And then internal also stimulants or thoughts that might be in the mind of children. We have to be able to talk about the outcomes. Positive outcomes are, for example, it might be relaxing for the children, but what is important for children is the social reinforcement. To attract the attention of parents, for example, to relieve stress and to decrease distress, and also avoiding negative or unwanted thoughts and challenges, but there are also negative outcomes, and we should be able to talk about these with the child. Some journals, some scales can be used. This is a self-monitoring form. This is something that we have to use every time we see the patient. When does it start? How did it last? What is the severity of the activity? What was the accompanying feeling, emotions? The area of plucking, is it eyelash, is it eyebrow, is it hair? And if they can accumulate these samples, and that's what we want from them. This method is much easier in teaks, but then again, this can be like a game, and the aim here is to make her understand or him understand the target behavior. So a therapist child will play this game, and during that time the child can actually pluck his or her hair, and then therapist also mimics these behaviors so that the child is aware of this behavior. The second is to develop a behavior and a counter behavior against this condition. Some features of this response: it should last for a couple of minutes. It should be it shouldn't be in correlation with this behavior. It should be in correlation, in harmony with daily activities, and it shouldn't be perceived or realized by others, like a fist or sitting on their hands, for example. There are hints in 4 areas or triggering impacts. In 2006, this is developed. It's a conceptual model, and here in this model, cognitive, emotional, motor, and sensory. These are the internal ones, and the environmental modalities, which is the external ones, should be grouped so that this counter behavior can be developed. And this is very important, and these should be the areas where you should interfere. If there is something in the cognitive process, like I have to have symmetric hair, for example, if this is a thought, then you have to restructure this thought. For example, this hair might have a more sound root, or stopping the thought stopping. For example, this curled eyelash should be plucked, and something like a reminder insertion or a stimulant control should be used. This is up to the creativity of the therapist. For example, a ribbon on the fist
lardan kurtulmak veya bunlar tetikliyorsa aslında emotional regulation, yani
for example, a rope in the hand might help the child to remember that. Emotional modality, if negative emotions trigger this behavior, relaxation, breathing, hypnosis, or other strategies can be used. In the emotional modality, we see it more in the adolescents and adults. For example, this unwanted hair might cause negative thoughts in this subject, in this patient. For example, white hair, gray hair. Gray hair can be a matter of distress, anxiety, concern, and then during the session we might talk about this, and then this might these anxieties, these concerns and fears can diminish. Motor modality is the most common one in children, automated plugging. Self-monitoring here is very important, and the other is to avert the reaction. Based on the locality of this action, you might of course choose your strategies, like a hat, like a scarf, like a glove, for example, maybe a band-aid, because the child cannot use a glove in the school, for example, cannot use gloves in the school, for example, or introducing some activities that would keep the hands busy, or cutting the fingernails too short can be also some remedies. Getting the attention somewhere else, replacing it and eradicating, these are the strategies, like bath, a face mask, and massaging the hands, or giving stimuli, like washing the hair very tough and combing the hair for a lot of time during the day, and also
mesela alışveriş yapması gerektiği, bunları nereye yerleştireceği, yani
giving something to her that would remind this stimulant. That is, for example, she will go to shopping, and then maybe certain things can be purchased. This is also important. For example, if there is also a habit of bringing the hair to the mouth, maybe certain activities can be introduced to keep both of these parts busy, like gum, for example, chewing a gum. For example, if the child is going to study in the bedroom, maybe these can be prepared and be placed in his bedroom, or during TV, for example, during the time he or she watches TV, these materials should be there available. Maybe if the finger needs to be kept busy, then something like a soft comb, for example, may be there. We used in 5-6 cases this together with the mother, and there was this product that they bought from the pharmacy, something like a cream that they bought from pharmacy, which is applied on eyelashes or eyebrows, and this was really good actually. Cortisone creams and for example shampoo that can be used in the case of itching if this triggers plucking, and changing hairstyle can also be tried. If there's an environmental modality, a stimulant control is needed. For example, if it's mirror, then you should get rid of mirrors. And all the other tools that help him pluck can also be removed. Of course, we teach these in all sessions, but it is important to really make them a part of their lives. And they can have, the patient can have tryouts, for example, and then we can talk about it, how they introduce these remedies in his or her life. Social support is very important to increase treatment motivation and compliance. Of course, the parents' compliance is very important. For example, our parents, in our culture, they are very protective and they interfere. Positive reinforcement is very important, reward is important, and then together with the parents we should define and determine this reward. And this is good when the patient practices this counter behavior, and then the parents can give feedback to the child as a result of his or her behavior, as a result of his or her way out, if he tries these methods. And the evaluation assessment is very important. This is a self-monitoring form and gives information about that. If your strategies is good, then we keep up doing that. If it's not, then we search why it was not effective. If there are problems, then we look forward to these problems, we dig into them, and then if we deem this effective, then we should stick with this technique. Yes, this condition is hard to be treated and chronically it repeats. And HRT is not that easy to be practiced. Another problem is denying the situation. This is really important because in both of these cases, in the case where the patient fails to consistently apply these techniques, and when the patient denies this condition, then you have to go back to the awareness education or awareness training. If there's a situation of crisis, then we can interrupt the practices and then focus on the solution. Prevention of repeats. This is important. If there is repeating pattern, then this pattern can be prevented. Maybe it can be due to a situation that created stress, but it doesn't mean that if the patient after these sessions pluck one or two hair, it wouldn't mean probably that he will continue plucking. Maybe they just wanted to try themselves. I mean, they wanted to see whether something will happen if they pluck 1 or 2 hairs. This again should be talked with the patient, and the patient should be informed by these patterns. Thank you very much.